Hi everyone, I'm Dr. Aziza Sesay. I'm an NHS GP, a GP educator, an Honorary Senior Clinical lecturer, a host, a speaker, and I'm also a health content creator. So I run the platform Talks with Dr. Sesay, which is all about health education, awareness, promotion, advocacy, because it's something I'm really passionate about. I feel that health information should be easily accessible to everyone in a way that they can understand, and I just feel like knowledge is power, which it is, and prevention is better than cure. So I do a lot of health awareness when it comes to women's health, gynae health, because that's a big passion of mine, but I also educate about cancer awareness and health inequity. So today I wanted to focus on women's health, gynae health, and what we can do as clinicians to make a gynae appointment more comfortable for a patient when they're coming in. Because a lot of the times they're quite nervous, it can be quite daunting, depending on the cultures, it can also be quite embarrassing, and it's quite intimate, isn't it? So a lot of the times we talk to patients and try and encourage them about ways that they can make the appointment better for themselves, how they can advocate for themselves, and so on. But I think that it's also extremely important that we as clinicians educate ourselves in what we can do to try to make the experience for them better. I'm not sure if you were aware, but a couple of years ago, the government released a call for evidence. So they had over 100,000 respondents, and about 80% of the respondents had said that they felt dismissed, that they weren't listened to. This is a common response. They feel that their clinician isn't listening to them and they're not being taken seriously, and so on. It's hard enough to book an appointment and come forward and then talk about something that some people find quite, difficult to discuss or embarrassing, and then to feel that way is just, it's not on. So these are just little tips that we can do as clinicians to try and help, as I say, to make the experience better for them. I guess the very first thing I'd say is acknowledge that this is an appointment that might feel daunting for the patient. So I think it's so important to be warm. It's important to give that smile, to be welcoming, because I think that's the first step that helps them feel a little bit more at ease. So that's just something that I would say as a number one. Number two, when we go through med school, or if you're watching this and you're doing any other health training, usually they teach us about what's called the golden minute. And that's where you allow your patient to basically just talk for a minute. And it's because in that time, you can gather a lot of information without the need to interrupt them often. And also, again, it's an open question, helps to bring them at ease so that they give you as much information about what their complaint is. And that often helps. I think it's also important that we continue to clarify things that are being said. A lot of the times, especially if we've heard something, a few times in the past, it's not uncommon to assume that someone might be experiencing symptoms that could likely be to do with something much more common, which is often the case. But I think it's important that we don't assume, and we clarify with our patients when they say that they're experiencing certain symptoms. Like, don't assume that if they say that their periods are just what they were always like, and we don't clarify, that their periods actually are heavy, and they've been heavy for several years, and they've suffered with this for several years, but they've never come forward to talk about it because they thought that it was normal. So yeah, I think it's really important to not assume. So first thing, smile. Second thing, give them that golden minute. Number three, clarify and not assume. So the next thing that I would say is important during the consultation is definitely talking through to the patient everything that you are likely to do with regards to the assessment. I know that there are different patients who have needs that may vary, but you can give them that option. So if you're going to examine them and you're going to, say for instance, do an internal exam where you're going to put in a speculum, I think it's definitely worth talking through how that process is. But you can sort of pre-warn them and ask, would you like to know exactly what I'm going to be doing during the examination? Do you want me to talk you through the procedure step by step? And so on, whatever is most comfortable for the patient. I think it's important that we don't lose the sense that this is an individual person who would prefer things in a certain way that would work better for them. So I would definitely encourage that aspect as well. And we shouldn't forget the importance of giving them that time whilst they're getting prepared for the assessment, and checking in on them regularly. So once they're done, are you ready? Can I come in? Seek permission. And then whilst we're doing the examination, I'm about to do this. Okay, I'm about to do that. Are you okay? Constantly checking in. I think that makes such a world of a difference, depending again on the patient. But usually, I've found that it's received positively. I also think it's important that we remember that something that we're used to doing quite frequently can be uncomfortable for patients, some more than others. And we need to remember conditions like, for instance, vaginismus, like in sclerosis, like in plainness, anything that can actually make those sort of assessments a lot more uncomfortable than it would do if it was someone who didn't suffer from this condition. So I think it's important to give the patient that control. If they're saying to you, this really hurts, please can you stop? We should listen to our patients and stop. Ask them if they want a break. If they don't feel confident enough to go through the whole process, I don't think they should feel penalized or feel pressured to do something if in that moment they're really, really struggling. So it's just, again, something for us to remember as clinicians. Once we finish with everything, again, give them the time to get dressed, and once they're ready, we have the discussion and explain everything that we found. Again, we need to remember not to use jargon, which can be difficult because we go through, for instance, medical school to learn the language just to sort of be able to translate it then to patients in a language that everyone would understand. So I think that's definitely super important, having that conversation in the language that they would understand, using simple terminologies, and then giving them the time as well to talk through what you've explained to them. Give them the opportunity to repeat things back to you so you know that they 100% understand, and then giving them the opportunity to ask questions, because we know that that's their right. They can ask us questions. They should ask us questions. I know that I'm sitting here and you're probably watching this and thinking, but the NHS is struggling. We don't have enough time. This is really difficult, and so on and so forth. And everything I'm saying is what would happen in an ideal world. But the reality is that I have found that spending the extra 1 or 2 minutes helps to make that individual feel comfortable so that they can come back for more help and support. And for instance, if you prescribe the medication, you've taken that extra time to go through it, they're more likely to comply, they're more likely to take it, I have found. So these are just little tips, little nuggets. I mean, you don't have to incorporate everything that I'm saying, but from my understanding, these things make a difference, because then the individual feels like a person and not just a patient or a number. It's really difficult when we're in an environment where things are really stressful and there's a lot of pressure on our shoulders and on our heads, and we're not being supported. So I appreciate that aspect as well, but I think it's important for us as well to try not to let the system break us. We became clinicians for a reason, and it's something that we'll never, and we should never lose that humanity, that humane aspect within ourselves. So that's basically all I was gonna say, really. I mean, a lot of it I know is things that you've probably already heard before, but if you're gonna take anything home, it would be please listen to your patients, keep smiling, and allow them to ask you questions. So yeah, hopefully I will catch you guys on my page if you ever want to watch some women's health content or cancer awareness, health inequalities or inequities, anything like that. You can catch it on Talks with Dr. Sesay on Instagram, TikTok, Facebook, YouTube, and so on. I hope that you found this useful. Well done for watching this far, and hopefully see you soon. Bye.
My name is Dr. Tiena, and I am a surgical trainee with a special interest in aesthetics and skincare. And it actually introduced me into marketing and building a personal brand.